So today I would like to talk about something that I see incredibly often in my clinic, and that women are often a little bit embarrassed to talk about, and that is vaginal infections. So firstly, what are vaginal infections? Well, effectively, these, as the name would suggest, are bacterial, yeast, or viral infections that can be found harvesting and harbouring within the vagina itself. So how common are vaginal infections? Well, they can be extremely common depending on the risk factors that are present in your individual background. So as you can imagine, having that initial consultation where we assess any risk factors for vaginal infections is incredibly important, because there are specific risk factors that can make you more prone to developing vaginal infections. So now, having said that, what exactly are the risk factors that can make you prone to developing vaginal infections? Well, these can range from having a urinary tract infections to having chronic medical problems such as diabetes, for example, or longer term health issues or immune system suppression, for example. Those are the things that we commonly see. And also, sometimes you may have symptoms of an infection, but they haven't been treated with the right antibiotic. So firstly, coming to see us early is incredibly important. Making sure you get the tests you need in an appropriate and timely manner is again really important, so that we can treat things and clear the infection as quickly as possible. So having said all of this, how do we assess for a vaginal infection? Well, firstly, I'll speak to you. I want to find out what your symptoms are. And the most common symptoms we find include abnormal vaginal discharge. That could be a change in consistency of the discharge that you're seeing. Could be a change in the colour, the smell, for example. And this is an assessment we make on a background of your regular history. So what's normal for you? Because remember, if you have a regular menstrual cycle, you will have changes in the vaginal discharge throughout your normal period cycle. So what we need to establish is whether this is normal for you, or what has changed, when did it change, was there a trigger factor? For example, having sex with a new partner. So again, knowing your background history of sexually transmitted infections, new partners, are all things that I would be interested to know. But the bottom line is, to diagnose an infection, we need to do tests. So the first thing I would do, having spoken to you, finding out all the details, not just of your symptoms, but of course of your medical background, would be to examine you. And that can include doing a urine test to make sure there aren't any urine infections which could coexist or exacerbate any vaginal infections. When I'm examining you, I will look at the skin on the outside, the vulva, first, and then I'll insert a speculum to assess any abnormal vaginal discharge and to see whether we need to do swabs for infection screens. That's generally the case, and where that's the case, we'll look at whether we need to do a sexually transmitted infection screen or just a bacterial screen. Generally speaking, for women who've had vaginal infections previously, or the history has been quite protracted, we tend to do both an STI screen and bacterial screen to make sure that we're not missing any organisms that haven't been tested for before. Now, in conjunction with abnormal discharge, sometimes you can get breakthrough bleeding. So it may actually also be relevant to think about whether your smears are up to date, checking the cervix, which we'll do on examination, and in fact, considering whether we need to do an ultrasound of the uterus, the womb, to make sure the lining of the womb also looks normal. So again, we will be guided by the symptoms to work out what tests are relevant to your case. So that's the symptoms and investigations that we always look at. What can we actually do about vaginal infections? Well, the clue's in the name. Depending on the type of infection we are able to diagnose, we will tailor the treatment to you. And often this is in conjunction with the pharmacy and the lab team to work out what type of antibiotic or antifungal agent may be suitable. So remember, the infection may not just be a bacterial infection itself. It may be a yeast infection, Candida, which is commonly the most common one that we see, or it may be viral, for example, human papillomavirus, which generally sits on the cervix. That's another test for another day, so I'll come back to that in another episode. But generally speaking, what we would look at is what type of treatment you need for each infection. And that's incredibly important, because if you don't get the right treatment for each infection, that encourages them to come back or not to clear completely. So that's why it's so important to make sure that we do a thorough infection screen and we're not missing any type of bacterial, viral or fungal infection, or protozoan infection in fact. So having that key log in our minds is what we go through when we're doing our assessment. We will always go through your results. We'll always look at lifestyle measures that you can take or have been taken, and also consider any other treatments that can be helpful. But the bottom line is, if there truly is an infection present, you may not be able to fight this simply by increasing the amount of water that you drink, or looking at diet and lifestyle changes. And so that's the type of tailored advice we will be able to give you. So I hope that's been helpful. Just in summary, today we've talked about a range of vaginal infections which are incredibly common. Yes, they can present with abnormal discharge, but other symptoms can include pain on intercourse, for example. So do remember that it's not just a change in discharge or bleeding that can relate to vaginal infections. And yes, investigations include taking a basic understanding of your medical problems and the symptoms, examining and of course doing any relevant infection screen or in fact scan if there is abnormal bleeding. And that allows us to then tailor the type of treatment which would be best suited for you, coming back to things again if we need to make sure everything is completely cleared and you don't need any further treatment. I hope that's been useful, and we very much hope to support you when you come and see us.